Firstly, I want to say good afternoon and thank you everybody for joining us. I'll get to a few points in a minute about what the city is doing to fight the spread of the COVID-19 virus and the effects it's having on our community, but I want to start by thanking our media for helping to keep our community informed. Information is, as you know, vitally important right now, and we appreciate you getting the word out to people about what measures are being taken to limit the spread of the virus and how people need to behave. And I also want to thank again all of our residents for the personal sacrifices you are making every day as this situation continues. I know this is not easy for anybody. It gets repetitive, but the BC Centre for Disease Control says the best way to prevent transmission of the virus is to isolate yourself if you're sick, practice physical distancing, and to wash your hands often. While most of our citizens are doing their part, unfortunately, we are still seeing examples of those who are not. We must remain vigilant. This is not the time to let up. There are many angles to this story, but the two dominant points of focus for local government at this point are the health risk and the economic fallout. I'm going to start today on the economic front this time, since we have a few new things to pass along. The city's economic approach during this pandemic is two-pronged: tighten our belts and be a catalyst for economic recovery. Every dollar we spend has a direct economic impact in our community. We're aware that anything we cancel or postpone has an impact on someone or some business locally. That said, our immediate focus is on cost reductions, considering revenue is projected to decrease. Effective immediately, staff have been directed to reduce operating budgets through the following measures. Reduce space budgets for non-essential and new spending. This includes things like professional consulting, materials and supplies, purchase and contract services, along with other specific area reductions. A hold on hiring, except for critical positions approved by the city manager. Currently, approximately 90 positions are being held vacant and 64 part-time positions were laid off. A hold on non-essential travel and training for staff. Review capital projects to look at potential deferrals, minimize capital expansion at the Kelowna International Airport, and reduce operations reflective of current airline traffic. In addition, City Council has directed staff to review the provisional budget presented to Council in December of 2019 and look at what might be eliminated or deferred. Council's expectation is the final budget, slated to be presented to Council on April 27th, will look different than the one approved in late 2019. An important point I'd like to point out or make is that local governments cannot run a deficit like higher levels of government and must continue to provide many essential services the community relies on, including but not limited to police services, fire protection, water, roads and transportation, and solid waste. We are also working on an approach to coordinate efforts of the Central Okanagan business community, both public and private, to overcome the immediate economic challenges of the pandemic and to proactively support and re-energize the impacted sectors of our economy. We are encouraged at the measures senior levels of government have taken to date, and their signal that more announcements are ahead will help to mitigate the impact to our citizens and businesses. We'll have more detail on the regional approach in the days ahead as that plan comes together. On the public health front, again, we are following Dr. Bonnie Henry's orders for city operations, closing buildings to the public, keeping a safe physical distance, working from home, enhancing remote services, and maintaining clean workplaces. City staff have been in conversations with the provincial counterparts in light of the new provincial order announcement on Friday. In general, the city will comply with whatever the province requires, and in fact is already doing much of what was announced. For now, the provincial order mandates local bylaw enforcement officers to act as educators to anyone not complying with the BC Medical Health Officer's orders for things like physical distancing in parks or businesses. They can also report situations of continued non-compliance to provincial public health authorities for their enforcement if needed. In Kelowna, the RCMP has been handling the majority of these complaints as they have both the jurisdiction and the authority to do so. The city is working with the RCMP to assume the first response duties and is working with Interior Health to ensure clear, consistent, and responsive processes are in place. We have also worked with our regional government neighbors to formulate a list of possible public buildings that might be needed for a variety of uses if the pandemic overwhelms existing services such as food warehouses, care homes, isolation areas, and hospitals. The province's suspension of local states of emergencies for municipalities in BC aligns with the city's decision not to declare one. The provincial state of emergency provides all the necessary powers to address the immediate needs in our community for safety and compliance with the medical health officer's orders. In closing, I want to thank our frontline workers, city staff, and all those who continue to provide essential service, preserving life, health, public safety, and basic societal functioning through this unprecedented time. We will get through this together, and we will recover together. I also want to make note of the last 2 nights where we had our emergency first responders, as a thank you to our frontline health workers, drive around the hospital in a show of support for the work that they are doing. I'd like to ask the public that we keep making noise every night at 7 p.m. as a way of showing our appreciation for those who are taking significant risks in order to care for us. And additional information received from the province this morning is requesting local businesses who may have stocks of select personal protective equipment that could be utilized for frontline health and support workers be donated through the province's recently announced supply chain management order. We will be sharing information on how to do that as soon as possible.